you get an accident. Before, when you go to a hospital, the first thing they used to ask you was the deposit. Under this SHA, this is the first administration that has operationalized, actualized Article 43(2) of the Constitution. No hospital, Mr. Speaker, let me say it unanswered, can deny a Kenyan admission. The public, the government is going to pay for you. And if a facility denies a Kenyan who has an emergency, I want to assure this House that facility we will deregister. For the first time, I am proud to say that a provision in the Bill of Rights has been achieved. Secondly, the fifth, timely payment of claims. All claims are paid on the 14th day of every month. Mr. Speaker, 14th of this month, which was 2 days ago, I want to assure all facilities that both public, private, and faith-based were paid. I stand and I want this House to hold me to account. If facilities are not paid their claims by the 14th of every month. We have done that. NHIF, the former NHIF, had no payment timelines. And that's why they left us with a bill of close to 24 billion. What are the challenges that the member have asked? We face challenges. The system is a super technology highway. Some employees are not remitting statutory contribution to SHA, denying service to their employers. Speaker, you are the chairman of the Parliamentary Service Commission. The clerk to the National Assembly is accounting officer. You remit statutory deductions, whether it is payee or NSSF or SHA, to us. We wonder why other arms of government and other levels of government should not do the same. But I want to confirm to the House that under my leadership, at least for SHA contribution, whether you are in private, in public, in the county governments, and I had a discussion with the Minister for Finance, it should be a check-off system. The Minister for Finance can remit SHA for all public servants from their salaries. Secondly, we have a very inadequate awareness on SHA. Despite the 40,000 Kenyans registering every day and above, there is a manipulation of the mean testing tool resulting in very accurate premium. There are people who take Kenyans and want to guide them, take money from them. I want to tell Kenyans to register for SHA is free. Nobody should charge you anything. And later I'll tell you how to register. I think one of the members of parliament has asked that question. Of course, we are facing challenges of management and reform. It is difficult. People don't want reform. They don't want, this system is watertight. This system is anti-fraud. This system will give you the best affordable, accessible, equitable health care. Honorable Speaker, the implementation of the Social Health Insurance Act of 2023, and I want to thank this House and the Senate for making sure all the regulatory laws to run this universal health coverage, you have passed it. I really want to thank through you, Mr. Speaker. That act is still at a very early stage, and most of the challenges that we face are more of operational and do not require legal intervention. If and when that is required, Mr. Speaker, the ministry notes that any need for any legal reform, we will propose the same to the Houses of Parliament. The second question was on how teenage mothers without national ID card. That question, Mr. Speaker, I want to answer it this way. Yes, there are many, many thousands of teenage mothers without national ID cards and indigents. SHA will identify them by a system deployed by the authority and the state measures that we need to put. These teenage mothers, Mr. Speaker, who don't have IDs are registered in all our public facilities, and they are given temporary IDs that enable them to access the service. Either young girls, the government pays SHA premiums for these registered teenage mothers who are given temporary ID. They are given SHA premiums, and I urge this House and other leaders, including our regional leaders, later to have a national conversation on the increasing number of teenage mothers in our country. But they are given temporary IDs, and the government pays their premiums, SHA premiums. For the indigents, and they are found in our constituencies, they are found in our counties, they are found in our country. They will be identified using the data we have by the Ministry of Social Protection, working very closely with the Ministry of Health, the county government, and leaders who sit in this august house using the NGCF method that you have been paying. The national and the county government and the NGCDF, we really want to urge all of us, the national, the county, the resources that you have as members of parliament, let us identify the indigent in our communities, use the social protection data, and let us pay for their SHA premiums for this important segment of our society. You can find this in the sponsors portal. We have a sponsors portal which is available at our website. This portal is known as Afya Yangu portal or app. You can use that if you have 100 and the CDF wants to pay for. You can use that to help the most vulnerable. Under the defunct NHIF, which was up to 6 months, depending on who you know, access to SHA benefits is very instant. As you are going to hospital, you can pay 1 month, you can pay 4 months, and you access. So it's not like NHIF where you have to wait for 2 months for the system to capture you. So it's very instant. The third question was the nature of covers offered by the authority at all levels. Honorable Speaker, SHA provides services as below. Number one, it provides free primary health care services at all public health facilities, level 2 to 4, and those contracted by the private and the faith-based facilities. And Mr. Speaker, this I really want to thank the House, because free primary health care is paid by government. It's budgeted by this House. And that is one of the things that has never been in our country, and that is why we are saying if you register and you go to level 2 to level 4, the dispensary, the health center, the sub-county, and their equivalents, both in the private and faith-based, you access, you are treated, you get medicine, you get everything, and you walk free, courtesy of your government. Additional services that Nhif, the Social Health Insurance Fund, for all paid-up members available at level 4 to level 6, and all contracted private and faith-based facilities. Then we have the emergency service, as I said earlier, for all Kenyans. You don't need registration or payment required. Any emergency. For example, a boda boda is knocked down, God forbid, by a vehicle. He is rushed to a hospital. He doesn't need to register. He doesn't need to pay. Nobody can deny him. No facility can deny him treatment. And he walks away home. This is something that has never been there, but it is in law. Article 43, sub-article 2 of the Constitution, where at the Bill of Rights, require government to do that. The last one, service we offer is chronic and critical illness services for all SHA paid members at level 5 and level 6. The details of these services that the member have asked, Mr. Speaker, are set out in legal notice number 47. The NHIF was not required to publish, but this House allowed us. Those services you can access, and a legal notice number 47 was created. The gazetted benefits are a huge improvement from the previous benefit offered by the defunct NHIF. They are aligned to the projected collections. These benefits we shall continuously improve in tandem with available resources. For instance, Mr. Speaker, this month, SHA and the ministry, we have enhanced the ICU package from 4,000 to 28,000 per day. And additionally, we have increased 150,000 extra for all cancer patients. And that is because of that chronic and critical illness services. Mr. Speaker, the next one was about the referral system. There is 3 levels of healthcare services or access in the referral system as shown below in the document that I've given to the colleagues who asked this question. All registered SHA members, Mr. Speaker, can access outpatient services at the primary health facilities, level 2 and 4, free primary health care fund, which this House has established, courtesy of this House. So they access it for free. Number 2, Mr. Speaker, all inpatient services are accessed at secondary health facilities, level 4 to level 6. Nhif, which is the contributory arm of the universal health care or the Taifa care, and paid by Kenyans, is where you can access those level 4 to 6 inpatients in those facilities, both public, private, and faith-based. For indigents, they will be paid by government of Kenya. They can be paid by our members of parliament through their NCGF. They can be paid by our county governments. They can be paid by Good Samaritans and sponsors. And the last one is all specialized services are accessed at our tertiary facility, level 5 to 6. That is where we have emergency, chronic, and critical illness, which is again, courtesy of this House, is funded by the government of Kenya. So this referral system, Mr. Speaker, is aimed at decongesting the specialized facilities to allow them to focus on the provision of specialized services as contemplated under the Health Act of 2017. Mr. Speaker, let me explain this. Why do Kenyans go to India, to other countries to look for specialized facilities? It's because our specialized facilities, like Kenyatta National Hospital, like Moi Teaching and Referral Hospital, like Kenyatta University, are full with the patients that can be attended to at level 2, at level 3, at level 4. Somebody with a headache will go to Kenyatta Hospital. Somebody with malaria will go to Kenyatta Hospital. Somebody with a small scar accident. Our specialized facilities should be for special cases so that we stop Kenyans going out to look for special facilities. And I really want to ask this House to support me that the men and women who work in our specialized facilities should attend to Kenyans who require special needs and not for ailments that can be done at the other levels of our health system. The other question was on the empowerment of the health facilities. How do we know this is a health facility? How do we grade them? How do we find a facility? Unlike before, Mr. Speaker, a facility now must be licensed by the Kenya Medical Practitioners and Dentists Council, and the Clinical Officers Council, and all other regulatory bodies within the health sector, they must tell us this facility is at this level. This facility has all that is required to be part of the universal health care. So these facilities must be licensed by the regulator. And if the regulator is the one who audits these facilities, if the regulator feels this facility is not level 4, is level 3, then the regulator will stop and will advise SHA. Secondly, and more important, and NHIF, Mr. Speaker, used to accredit facilities itself, making facilities to pay for them to be empaneled even after being licensed. So it was who you know, it was how much money you pay for your facility to be accredited by the defunct NHIF. Now it is different. And when I had a meeting with the Council of Governors, we still had about 2,900 primary health facilities which have not been licensed, which we have asked them to give us the names which they have already provided, and the Kenya Medical Practitioners and Dentists Council and the other regulatory bodies within that sector will. The approved SHA staff establishment, Mr. Speaker, is a question that I was asked, is 815. And in line with the first schedule of the Social Health Insurance Act that this August House has passed, SHA has advertised positions and is giving first priority in the act that you have passed. The first priority will go to the employees of the defunct NHIF. NHIF staff who are not absorbed by SHA, because SHA is more of technology driven. The number will reduce. Those staff will be deployed within the public service. No one will lose their job. But let me do it with a rider. Your certificates must be genuine. If you are working at NHIF and your degree is fake, we will not only not post you to any other place, but we will refer you to the institutions within the criminal justice